Hello and welcome, everyone. My name is Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm joined today by a very special guest who I'll introduce in a moment to talk about the healthcare provisions in the American Rescue Plan. President Biden signed the American Rescue Plan into law in March, and it's already helping to speed vaccinations, put money in pockets, people in jobs, and keep kids in schools safely. But today we're here to talk about a very specific and critically important part of the American Rescue Plan, the part that makes healthcare less expensive for millions of Americans. These are policies that I've been fighting for since I was elected to Congress, including my Healthcare Affordability Act, which lowers out of pocket premiums for marketplace plans. To see savings right away, people are going to need to take action, and we want to help make this as simple as possible. I am delighted to have Cynthia Cox with me today to talk about what folks need to know about the healthcare savings in the American Rescue Plan. Cynthia is a vice president and expert on the Affordable Care Act at the Kaiser Family Foundation. Thank you so much for being with us today, Cynthia.
Oh, thank you for having me. It's a pleasure to be here.
So, Cynthia, I want to start this off by explaining how the American Rescue Plan will save people money on healthcare. So, first, let's talk about how the American Rescue Plan makes health plans available through the healthcare.gov marketplace less expensive than ever, including for people who didn't previously qualify for tax credits to lower the cost of their premiums. So, Cynthia, can you tell us how the American Rescue Plan lowers out of pocket premium costs and for whom?
Sure. Well, to start out, I should just add I work at the Kaiser Family Foundation. We're not associated with Kaiser Permanente, the health insurance company. We're a nonpartisan, nonprofit research group. So everything that I'm presenting here is unbiased information. So to start with, the American Rescue Plan makes it so that nearly everybody who's buying their own health insurance can save money. So it used to be that a lot of middle class families were priced out of health insurance, even under the Affordable Care Act. So what the American Rescue Plan does first is it gets rid of any income threshold on eligibility for financial help to get your own insurance. It also makes it so that even people who were already eligible for subsidies can now get even more financial help than they were before. So what that means is, especially if you're uninsured, you should really go on healthcare.gov or talk to a navigator or an insurance broker, because there's a very good chance that you're eligible for subsidized coverage, even free health insurance. There's a couple of other things the American Rescue Plan does. It also makes it so that Cobra Subsidies are available to people who have been recently laid off. And the law also creates incentives for states to expand the Medicaid program, although we're still not sure yet which states, or if any, will expand Medicaid.
We hope all of them. Editorial comment.
So those are kind of the main ways in which the law makes health coverage more affordable, and really it can help millions of people.
Good, thank you. And so, if someone wanted to learn more about their new healthcare costs, how would they do that?
So the first place to go is healthcare.gov. It's designed to be a one-stop shopping place. So no matter where you live or what your income is or what you're eligible for, you can start at healthcare.gov. And then from there, it will either direct you to the proper place to go, or you might even be able to sign up right there. As of a few days ago, on April 1st, healthcare.gov was updated to show these new subsidies that are available under the American Rescue Plan. And so even if you checked healthcare.gov pretty recently, you might want to go back online again and check to make sure, because you might be eligible for even more help than you thought you were. One note of caution is that if you're receiving unemployment insurance, there's extra help that's also available for you. So we can talk about that too. But that might not show up on healthcare.gov just yet. In the meantime, you can go to KFF's subsidy calculators. That's kff.org/interactive/subsidy-calculator. And there you can get an estimate of what kind of help is available for you if you're getting unemployment insurance.
Great. And so if someone wants to enroll, what do they do?
So again, the first place you can go is healthcare.gov. You might be able to sign up there or be directed to where to go to sign up. But a lot of people need one-on-one help to actually get signed up for coverage. So if you're feeling confused or overwhelmed, you're not alone, and there are resources available to help you. The first place that a lot of people go is to call healthcare.gov's customer support line. It's a 1-800 number where people who are answering the phone are trained to answer health insurance questions. If you need even more help, you might want to consider talking to a navigator or an assister. These are folks who usually work at local nonprofit organizations, and they can give you unbiased information about health insurance. Finally, another option is to talk to a health insurance broker or a health insurance agent who can also help you get signed up.
Okay, so here's the deal, right? People can visit healthcare.gov around the country to sign up for coverage, but as Cynthia mentioned, right, it may be challenging and you might have some questions and need to talk to somebody. And so there are resources all across our community here in Northern Illinois, but if folks have questions, they can always call our office to 630-549-2190. Okay, so Cynthia, I want to switch topics a little bit. Let's talk about the special provisions for anyone who received or who's approved to receive the unemployment benefits in 2021. You touched on it very briefly, but the American Rescue Plan has even more benefits for these folks. And so can you walk us through what those benefits look like?
Sure. So if you have either received unemployment insurance benefits or have been approved to receive these benefits at any time in 2021, you are now eligible for extra financial help. So no matter what your income is, you will be eligible for a free platinum-like plan on the exchange, which is healthcare.gov or your state's marketplace. That means that you don't have to pay a monthly premium. And your out-of-pocket costs will be very low when you go to the doctor. You might even not have to pay anything. It's one of the best deals that you can get when it comes to health insurance. So if you're eligible for it, then you should really consider taking advantage of it. Now, as I mentioned, healthcare.gov might take a little while to get updated to actually show this. You're technically eligible now, but this is just one of those things that takes a little bit of time to implement. So what I would probably recommend doing is going to healthcare.gov and signing up for a silver plan, even if it means that you have to pay a little bit each month now for maybe for the next couple of months. Eventually it will become $0 and you'll get back paid any premiums that you paid that you didn't have to. So silver plan is probably the best level of coverage for someone who's getting unemployment insurance benefits.
And we expect Health and Human Services, which is the federal agency that's responsible for healthcare.gov, to update the website by this summer for those folks who are receiving the unemployment benefits so they can take a full advantage of those platinum plans at zero cost that Cynthia was describing. Okay, so next let's talk about Cobra. For those who don't know, Cobra gives workers and families who lose their employer-sponsored health insurance the right to stay on that employer-sponsored plan under certain circumstances, but it wasn't cheap. So before the American Rescue Plan, you'd have to pay the full cost of your premium, the full cost, which is almost impossible for people who just lost their jobs and their sources of income. So Cynthia, can you tell us how the American Rescue Plan impacts Cobra?
Yeah, so Cobra is very expensive normally. It could be hundreds, if not even $1,000 or more for a lot of people. But the American Rescue Plan creates Cobra Subsidies that will cover 100% of the premium for people who are eligible. So what that means is if you've been laid off and you're eligible for this help, then the law requires your former employer to cover the full Cobra premium, and the federal government will then reimburse your former employer for that cost. So even if you were laid off maybe earlier this year and you think you might have missed the deadline to sign up for Cobra, you should still check back with your former employer because the law also extends the amount of time that you can get these to get Cobra and also to get these subsidies. Now, a lot of people who are eligible for free Cobra might also be eligible for free marketplace coverage through healthcare.gov or their state's exchange. So which plan you pick might depend on your own individual circumstances, and you should consider factors like how much money you've already paid towards your deductible, and also how long you think you're going to need to be getting your own coverage.
Because people should remember that that Cobra plan is the same plan that you would have had while you were working.
That's right. Yeah. So if you were already, like, so let's say you had a surgery earlier in the year or a major hospitalization and you already met your deductible, then there's probably a good chance that you want to try to keep that same plan. And now the premium would be $0. But if you're pretty healthy and you hadn't really spent much towards your deductible and your employer plan, then it might make sense for you to get the free coverage on the marketplace. It really depends on kind of what you're eligible for and what your personal circumstances are.
Yeah. So now you touched on this, but for the consumers who already paid the significant out-of-pocket costs towards their deductible and are thinking about switching plans, like what does that mean for their out-of-pocket costs?
Yeah, so there's a few things to consider. For people who were in employer coverage and might have already paid a significant amount towards their deductible, then you probably want to try to stay on Cobra and take advantage of that 100% premium subsidy. Now, if you've already moved onto the marketplace or you're already buying your own health insurance, then what you want to do is talk to your health insurance company, because especially if you've been buying directly from an insurance company, like you're buying off of the marketplace or off of the exchange, then you have to transfer into the marketplace or onto healthcare.gov in order to get these new subsidies. But for some people, that might mean having to start their deductible all over again if they're having to change plans. So the best thing to do is to talk to your insurance company first and see if they're willing and able to apply whatever you've spent towards your deductible towards your new plan on healthcare.gov. And we are hearing that a lot of insurers are willing to do that.
We've been seeing this question online, and so wanted to make sure that we included it. Thank you so much, Cynthia, for answering that so clearly for us. So let's talk about impact. The Kaiser Family Foundation has done some research into how much this is going to save people and how many more people will benefit from lower out-of-pocket premiums. What do we know in terms of what this will mean for people regarding savings?
Sure. So what we've estimated is that almost everybody who's currently buying their own health insurance, so more than 90% of people will save, 90% of people who are buying their own health insurance will save money on their monthly premium. Some people will save, maybe $50, $70. Some people will save hundreds of dollars each month. It really depends on your personal circumstances. But if you're saving a lot of money on your premium, that might also mean that you can afford to buy a more generous plan that also has a lower deductible. We also have found that these new subsidies are so generous that among uninsured people, at least half of uninsured people can get a free plan. Most of those who can get a free plan would also qualify for very low out-of-pocket costs too. So there are probably, almost 10 million uninsured people who can get free coverage with little to no out-of-pocket medical costs associated with that. And there's even millions more uninsured people who could get maybe free coverage, but they have to pay a deductible, or where they might have to pay a subsidized premium. But what healthcare.gov is showing is that among current shoppers, most of them can actually get a premium that's less than $10 a month. So these subsidies are very generous. And if you're uninsured, there's a very good chance that you could get significant financial help to get covered.
That's great. And what else can we share with people about what these changes mean for them? Is there anything that we didn't cover?
Well, I think that, we do a lot of surveys of people who are uninsured or who are buying their own coverage. And a lot of uninsured people cite cost as their main barrier to getting covered. And that's with good reason. They know that health insurance in the US can be very expensive. But unfortunately, a lot of uninsured people don't know what it would actually cost themselves to sign up for coverage. And so they might not even realize what kind of generous help is available to them, especially now that there are these new subsidies or expanded subsidies that just went into effect. So if you're uninsured, there is a very good chance you could get help to get covered. If you know someone who's uninsured, they might not realize this. So definitely reach out to your friends and family who need health insurance coverage, and let them know that there might be even more help available to them. The American Rescue Plan hasn't brought us quite all the way to universal health insurance coverage, but it's brought us a lot closer to
Mhm.
making most people eligible for affordable coverage.
I just thought of this. When people log into healthcare.gov and they're looking at the pricing, it's not going to be labeled subsidy, right? And so, how do they know what they're seeing and if this is the current information? Can you just talk us through what that user would see on the screen?
Yeah, I mean, in most cases, you might see when you first enter in your information, you might get a pop-up window that says what your tax credit is, and that means that's how much of a subsidy or how much financial help the government is giving you to pay for this private plan. The other thing you can do to make sure, because there's some people who are getting unemployment benefits who might not see their full benefits show up on healthcare.gov or their state's marketplace. So again, they can go to the KFF subsidy calculator, and there they can match up their results, and it'll explain to them what kind of financial help is available to them under the new law.
Yep. So basically, a subsidy is the same thing in this instance as a tax credit, which for users, consumers, means that it's just lowering their out of pocket cost as they pay their premium each month. Cynthia, those are all the questions that I have for you. I want to just thank you so much for being with us and all the work that the Kaiser Family Foundation does. And we are just so grateful to have you as a resource for all of us. Thank you.
Thank you. Thanks for having me.
And we're so excited and grateful to have everyone watch us and our conversation this afternoon. Please reach out to my office if you have any questions at all. You can find us at 630-549-2190 or online at underwood.house.gov. And don't forget to check out our other videos to learn more about the healthcare provisions in the American Rescue Plan and how you and your family may be able to save money. Take good care of yourselves, everybody. Thank you.